Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Proxyl intermission or a Proxyl interlude. This audio podcast as part of a Cataclysm Chiasma. This audio podcast as part of a Storm Robotics production. So, against the a backdrop of impossible demands being placed on general practitioners, for example, and hospital physicians within the National Health Service, a high profile a high sort of profile national organization referred to as the Patients Association, had adapted the sort of strap line, the strap line following from documented works from 2011, from works from 2011. No decision about me without me, in light of the influential sort of publication from 2000 from authors in 2011 concerning shared decision making in medical practices. Similarly, the British Medical Journal had begun a campaign to encourage and prompt doctors or physicians to form partnerships form professional partnerships with and prompting sort of patient involvement. So physicians recognize both the moral importance and desirability of the idea of expert patients. However, in terms of compliance with treatments or regimens, and awareness of health and healthcare conditions, healthcare professionals suggest have suggested that due to the practical pressures of time and resourcing placed on general practitioner, the cultural barriers potentially created by differences in, for example, language and background knowledge between general practitioner and patients, it is unreasonable to expect the general practitioner to make available time and to acquire further complex communication skills in order to enable a patient to enter into dialogue and acquire expertise of the condition and treatment modalities. Amongst the plans set out in the strategy document published by the National Information Board, which brought together sort of organisations in amongst the United Kingdom with responsibility for healthcare, is a move or had been is a move to digitalize, for example, the red book, for example, the red book given to all new mothers in which to record in which to record the an infant's sort of information. And after a successful scheme after a successful scheme in London in the United Kingdom, terminally ill patients will now have sort of digital records detailing how, for example, they wish to be they wish to they wish to, for example, die, which will be accessible to ambulance services, accident and emergency departments, and the NHS sort of helpline helpline which will be accessible to ambulance services, accident and emergency departments, and the NHS helpline. Retrospectively, at the same time, NHS England's Director for Patients and Information had informed that these are a series of quite radical steps to modernize healthcare by making it more digitally supported, and an excerpt from NHS sort of England's Director for Patients and Information at the time when when works had been when works as part of this series, as part of this audio podcast series had been published, had informed, we must embrace modern technology to help us lead lead lives, and if uh, uh, sorry help us lead sort of decent lives, and if we want to take more control, and if we want to take more control when we are unwell. Our ambition is to make the NHS a sort of a digital pioneer for our patients and citizens. That draws this audio podcast to a close. This audio podcast, as part of a Proxyl interlude, or as part of a Proxyl interlude, a Proxyl intermission, and this audio podcast, as part of a Cataclysm, Chiasma, and this audio podcast as part of a Storm Lobostics production.